when we think about diagnosis, treatment, maintenance,
Mhm.
how are you seeing socioeconomic factors coming into play when it comes to patient journey in general?
Yeah, that's a very big factor. And in the sense that maintenance therapy requires long-term care. So multiple visits to the doctor, patients may not be able to work, so their source of income is affected. That may affect their ability to obtain the medications and to maintain their visits. So these are factors that we also think about when we're treating our patients. We do have social services to assist in that area in whatever way possible. Mm.
Interesting. Um, and when I think about just
Mm.
along the same lines of those socioeconomic factors, at places like SABCS, we talk a lot about cutting edge treatment,
Mhm.
cutting edge, things that are getting really close to personalized medicine and things like that. How do you see the access conversation kind of unfolding when it comes to applying some of these newer strategies or new treatments among your patient population?
Mhm. Yeah, so I have not really had a lot of issues with procuring newer treatments for my patients, except the ones that are like hot off the press and are not yet in the guidelines. They may be FDA approved. Some of the insurance companies are not willing to cover those medications. But in general, I really haven't had a lot of issues in getting medications that are standard of care for my patients, even if they are cutting edge and highly advanced.
Interesting.
Yeah.
And do you see patients maybe doing their own research at all? I know, like, just in this age with
Mm.
especially with younger patient populations, people may be going online, kind of having their own idea of what treatment routes are. Do you see a difference in the way that patients are approaching those care decisions, especially for younger populations,
Yeah.
utilizing other resources and things
Oh
like that?
yes,
Yeah.
yes. They will come in and say, "Oh, how come you're not giving me this drug? I saw it on TV." Or I have a friend who told me that they have, this type of cancer. We have the same cancer. Why are you not treating me the same way that that person is being treated? So yes, we do
Mhm.
have those encounters and conversations.
And
Yeah.
how are you navigating that kind of those conversations when it comes to them kind of comparing options? What's been your experience in that?
Yes. So I told him that it's a good thing that now we don't have a blanket treatment that we apply to everyone. We can now tailor our treatments based on specific characteristics of the patient and the cancer. So we tailor their treatment to suit them. And that has been enough to, sort of temper any anxiety.
Here at SABCS, were there any particular studies or areas of focus that you were excited about coming here? Yeah.
Yeah. So there's been a lot of mention about AI and application of that. That's a new frontier. Everyone is talking about AI in every area of society. Um, so that is also going to be incorporated in breast cancer care or in cancer care in general going forward. And also, a new drug is now available for early stage hormone positive breast cancer, which we did not have. This is since for the past 20 years, we haven't had any new drugs in that space. So I'm very excited about that in the sense that the ones that we do have now, which are hormone therapies, they produce a lot of side effects, which many patients find it hard to tolerate, which this new drug does not produce those same side effects. So we're looking at greater adherence with medications and better outcomes in the long run.